Okay, so hello everyone. My name is Tanya McGee, and I will be discussing Instigating a Neighborhood Equity Impact Assessment. I'm currently a doctoral candidate at Binghamton University, where I am researching variables in segregated communities and how they contribute to trauma in Black women. As a practitioner, I'm an urban planner in Chemung County, where I focus on various community issues such as housing, zoning, the environment, economic development, etc. So speaking toward the history of urban planning, there were various methods used to segregate and seclude marginalized people. So redlining, which began in the 1930s, was the act of banks and other financial institutions that refused to offer loans to undesirables. So these undesirables could be people struggling with mental health, people with issues of physical disability, Jewish people, low-income people, but it always meant Black people. So once these communities were identified, they were literally cleared by way of urban renewal, by way of eminent domain for various uses, often for highway and interstate systems. As a result, thousands of families across the United States were displaced. And as a result, we're left with historically redlined neighborhoods that are concentrated by crime and poverty, ultimately catalyzing trauma in residents within these communities. So as a result of these displaced and isolated communities that are concentrated by race, they're also concentrated by violence, crime, and trauma. So both maps shown on the screen are of the city of Syracuse. The redlining map on the left displays colors green, blue, red, and yellow. The green areas were graded as the best. They were homogeneous, predominantly white, and affluent. Blue meant that these neighborhoods were still stable and pretty homogeneous. The yellow neighborhoods were designated as declining neighborhoods, meaning that Black people were slowly migrating into these areas. And the red areas were the redlined areas, of course, designated as hazardous because of the large presence of Black people living there. So the concentration of redlined communities was home to the historic Fifth Ward that once flourished in Syracuse. So if you can see my mouse, here in the center of this redlining map is the historic Fifth Ward of Syracuse, until Interstate 81 was constructed right in the middle of it. So fast forwarding to today, the map on the right, also the city of Syracuse, is a map of confirmed gunshots between the years of 2009 and 2014, which are represented by the yellow dots. They are concentrated in the very same areas that the other map has designated as redlined areas. So these segregated communities are now low-income census tracts, they're food insecure, they're low access points, and they're plagued by violence. So using the city of Syracuse and other upstate New York cities as study areas for my dissertation, I'm trying to understand how neighborhoods of color experience the traumas related to segregated neighborhoods. So my recruitment criteria includes Black mothers and primary caregivers that live in segregated census tracts that have lost a child due to violence, as well as organization leaders of grassroots groups that focus on street violence. My methods include qualitative one-on-one interviews, secondary data analysis, and the administering of the post-traumatic stress disorder civilian checklist. So this PTSD civilian checklist is not by any way a diagnostic exam. Instead, it allows people that have experienced trauma to rate their symptoms and compare them to the established symptoms of someone with PTSD. So my findings for this research include that most mothers have never left their neighborhoods and they remain isolated in their communities. Communities are lacking social and economic mobility. Youth are viewing risky and illegal behaviors as their only option to provide for themselves and for their families. Black women are losing their children to street violence at exceeding rates without the necessary resources to remediate it. And the legacy of segregation continues to be experienced by Black people, and it should be seen as an environmental concern instead of just strictly a social concern. So New York State has recognized various environmental concerns and their impacts on surrounding communities. There are specific policies that are already in place to prioritize safety for these communities. One example is the State Environmental Quality Review Act, also known as SEQR. It is enacted by New York State for all local and state government agencies to enforce at their own discretion for various projects. They must reflect the environmental impact of actions. It requires agencies to balance environmental impacts with social and economic factors, and it may trigger an environmental impact statement. So these environmental impact statements require project leaders to just take it a step further and really uncover all of the impacts that are possible and how they will remediate them. Another example includes the Senate Bill S4745, which establishes the Racial and Ethnic Equity Act of 2021. This bill is currently in the Senate. It has been adopted by states such as Iowa, Colorado, Maryland, Maine, New Jersey, and Virginia, and it is used in criminal justice policymaking to determine if potential bills are likely to create or exacerbate disparate outcomes among people of different races or ethnicities that may already have different encounters with the criminal justice system due to systemic racism. So these are just two examples of New York State policies that are introduced for environmental protections. Considering my own work as an academic and as an urban planner, there is a need for policies that join issues of race and place and community. So my own policy recommendation is a neighborhood equity impact assessment. This policy would require that all developments occurring in New York State designated disadvantaged communities, opportunity zones, and low-income census tracts be assessed for adverse effects on Black and other historically marginalized communities. Some of the questions that might appear on this assessment could be, what is the racial makeup, median household income, unemployment rate of the project area? Will this project adversely affect the mental, physical, and emotional health of residents in its surrounding communities? Does this project have the potential to displace existing residents? And what measures would go against this? Will this project advance homeownership and in turn increase Black generational wealth? Will the desired project take infill development into consideration, or will the project demolish inhabited structures? And from a planning point of view, this is very important because we realize that the increase in vacancies also leads to an increase in crime. What is your public engagement strategy, and how will residents be engaged and educated throughout the process? How will the project positively benefit Black and other historically marginalized communities socioeconomically? Will this project create jobs that could employ people living in these communities? And lastly, will this project advance access to multimodal transportation or otherwise provide access to services? So earlier this month, New York State Governor Kathy Hochul announced her budget plan, which included $1.1 billion for the deconstruction of Interstate 81 in Syracuse. So the photo to the left is Interstate 81, which directly cuts through the historic Fifth Ward that I mentioned previously. And on both sides of it are the Pioneer Homes public housing. To the right, there's a woman that lives in one of these housing areas that is wiping the soot that's blown in from the highway. So now, after the planning process has already begun and after the funding was already allocated, community members are coming forward, having conversations pertaining specifically to lead and asthma abatement because there was no policy in place to protect them. There is, however, a 42-page environmental impact assessment. However, there's no mention of lead abatement. I-81, which was constructed in 1959, is covered in lead paint. 1 in 5 children living in these neighborhoods are already lead poisoned. So vital questions from my policy would ask project leaders to consider questions such as existing makeup of the community, how the projects may adversely affect the health of the community, questions concerning displacement, and prioritizing public engagement and education. Thank you all so much for listening, and I yield to the judges.
Great, thank you very much. How do you use SEQR on this 81 project? Because I think, right, that is one of the instruments the state on public projects uses. But I get your point on all of the issues associated with dismantling a highway and figuring out what you're going to do next. Have they been using seeker? Has it been, it's supposed to be a public process? You know, how has that been working?
So they did the method, which then triggered the environmental impact statement. I am a part of a group, a lead coalition in the city of Syracuse that I've joined. And there hasn't been a lot of public education or outreach to the communities that will be directly affected by the deconstruction of I-81. So although it is a great thing that's happening for these communities, they are not aware of the health implications. Well, they are aware of the health implications, but they're really not sure what the city is going to do. And they haven't been, the project leaders haven't been held accountable to really educating these groups.
Yeah, the other thing, only because I used to have to worry about it, is like seeker's kind of driven by the state agencies involved, right? Not so much by the communities. How do you bring those pieces together?
Well, seeker could be driven either at the state level or at the local level. I'm a local planner for Chemung County, and I look at, or I fill out a lot of seekers. But I think because this is a state-funded project, there is a gap that hasn't been filled to educate the residents. So at this point, there are grassroots organizations and different advocacy groups that are now trying to come forward and educate these people. But however, like I mentioned during the presentation, the planning has already been established, the funding has been allocated. So at this point, it's really just a struggle and these residents advocating for themselves and for their children.
All right, an unanswerable question, but I'll ask it anyway. What's your view on how has COVID affected all of this?
That's a really good question. I think COVID has definitely affected mobility. It has affected maybe public meetings that people weren't able to get to where they could advocate for themselves. I know that our legislative meetings were virtual. And I think earlier someone had asked a question regarding the digital divide and how to get around that. But if these people can no longer meet in person to somewhere that's easily accessible to them, how would they get this information?
Thanks.
Great. Jeff, do you have a question?
Yes, thank you, Tanya. Mine is the example of I-81 in Syracuse is powerful, and hearing that there are other cities that are considering undoing past wrongs. My question is that with respect to the gap that you and Bob were just discussing about what's decided at the state versus at the local level, does your research suggest that communities that have already recognized past injustices and are taking steps to remediate that, such as dismantling I-81? And then you look at New York City, where there was the case where they had the pedestrian bridges ranged so low that the public buses couldn't get to the beaches. Should that factor into the CEQA to say, well, if you're already making steps, you get some credit. If you haven't addressed these past injustices, we're going to take a harsh review.
I think that would be a great idea. I think your example of Robert Moses and the construction of, the lower bridges, I think it could be on a point basis if that's what you were referring to, or just more of a harsher critique to areas that are already, looking at similar projects such as 787 in Albany or the Interloop project in Rochester.
Yeah, I'm not sure if it should be qualitative or quantitative. I agree, but on the other hand, it should be a consideration.
It should be a consideration. And I think that for so long, quantitative work has been preferred, but I really don't think you can learn the relationships between people in place without that qualitative aspect. So,
okay, thank you.
I love the Robert Moses example, but I have to tell you, I grew up in the Bronx, and no one asked any questions about building the Cross Bronx Expressway or the Bruckner Expressway, right? But the health effects of those on, a population probably 5 times the size of Syracuse, right?
Absolutely.
I think an interesting thing to do in some urban areas, and I think Jeff was getting at this too, would be to go back and look at what the impact has been historically also over time, because all the effects on communities that you talked about happened,
Right.
but people really haven't looked at the health aspect.
Definitely. I think there's a gap between urban planning and public health that needs to be addressed.
Kate?
Yeah, and I appreciate the important point you made about that there needs to be community involved, because a lot of times, historically, it was, state policymakers saying, well, here's what we think will happen. I wanted to make a comment that there recently was a law passed that's called a health equity assessment that conceptually has some of the same ideas, and it's around when there's going to be kind of a major hospital project or other medical project, what would the impact be on marginalized populations? So it just may be something you would want to look at as you're
Definitely.
moving forward on this. It was Senate Bill 1451A.